These days, summer is in full bloom, and so many people daily are coming with headaches. Many of them self-proclaiming that they have got migraine. So let's discuss today and make it very, very clear that every headache is not a migraine, and a migraine is not just a headache. It is a complete neurological disease which impacts the brain's ability to interpret all the stimuli, all the information that is coming from all our sensory organs. As a result, a migraine will have a headache, and along with that, there will be photophobia, that is sensitivity to light. Then there will be tinnitus, there will be ringing in the ears. There may be phonophobia. All the sounds will seem too loud. Then there may be osmophobia, that all the smells, they seem very, very unbearable, the strong ones. And then there will be allodynia, that is the stimuli which are normally not painful, they will also be perceived as painful. For example, if I just move my hand slowly over any body part, it is not a painful stimuli. If I move a feather, then it is not painful. But when people are under a migraine attack, these normal stimuli will also seem painful because the brain's ability is disturbed during the attack. Therefore, a migraine is not just any run-of-the-mill headache, but it is a headache which starts slowly, and then within minutes to hours, it becomes very, very severe and throbbing. There is drumming on our ears. Every light seems like a glare. Then every smell irritates, and all you want to do is lie down in a dark, cool room and rest. Along with that, the pain is so severe that you may be having nausea, you may be having the feeling to puke. So, why does this migraine happen? What are the triggering factors? What you can do about it? Are there any investigations for it? And how do you treat it? This is our topic of discussion today. I'm Dr. Marium, Ateeq. So these migraine attacks, they occur when there is dilation and constriction of the arteries in the brain. Why do these arteries behave like that? There are certain triggering factors. What are the triggers? Stress, anxiety, lack of sleep, or change in the sleep pattern. Then caffeine withdrawal. For example, when we are going on a diet or we are fasting and we cannot take the normal amount of tea or coffee the body is addicted to, this caffeine withdrawal can also trigger an attack. Then too much strenuous physical activity can bring it on. Strong smells like the smell of strong perfume or oud, that can trigger a migraine. Then skipping meals can do that. If you're having alcohol or you are smoking, sometimes that can also be a triggering factor. Then in ladies especially, when there is a decrease in the estrogen level, that usually happens premenstrually, either 1 to 2 days before till the first 3 days of the menstrual cycle, this can trigger migraine attacks. Similarly, the use of birth control pills can do that too. Then certain foods can trigger migraine attacks. For example, the red wines, the monosodium glutamates, which we commonly know as the Chinese salt. Therefore, people can relate that when they have Chinese food, they start having a migraine attack. Then beans, the broad beans, the flavor beans, they can bring it on. And then there are the common 5 C's of migraine attacks regarding the food. These are too much Coke, too much coffee, too much chocolate, too much citrus fruits, or cured meats. Those are the meats that are salted, they have been dehydrated, or they have been treated. For example, the processed ones, the sausages and the nuggets and all those can trigger them on. Then they can be the aged cheese. All these foods have a ability to trigger on migraine attacks. Now, migraines can be of two types. The common type, which has got no sign or symptom other than the headache and then feeling nauseous and having the photosensitivity. But the classical one, it does not come unannounced. It has got warning signs, which is called the aura of the migraine. Now, what is this aura? 10 to 15 minutes before the actual migraine headache starts, the eyes, they start getting blurry. The vision becomes narrowed. There's tunnel vision. That is, only the central part of the visual field can see clearly and the outside areas cannot be seen clearly. There may be blind spots in the visual field. There may be colored spots in the visual field. And then a person might feel that they can see stars in front of their eyes or light going in the zigzag manner or flashes of light before the migraine attack starts. Then classically, the attacks last for 4 hours to 72 hours. And after that, they wear off with the proper treatment and the rest. But the classic migraine is going to have a hangover, which is known as the migraine hangover. That is the feeling of fatigue, the feeling of drained energy, the feeling of wanting to sleep more and more stays on for another few hours to 1 or 2 days. So what do you have to do? You have to first of all make notice and keep a migraine diary that will answer the questions that what happens. What are you doing when the migraine starts? Is it after some exercise, or you are in a concert and hearing loud noises, or you are in a noisy classroom, or in any noisy place, or you have been to a mall and you have inhaled some strong scents, perfumes, ouds that brought it on, or was it premenstrually for you, whatever. And then how long does it last, and when are the cycles of migraine more common? When are the attacks more common? So you have to maintain this diary, and then you have to contact the doctor, of course. The doctor is going to take a proper history, and they are going to advise you tests. Simple tests, some blood works, then there may be requirement of the lumbar puncture, there may be requirement of CT scan of the brain, MRI of the brain, and these will clear out what is the exact cause. Is it just anemia, or is it some vitamin deficiency, or you actually have a migraine attack? Then the treatment. The treatment is not very specific, but what you have to do is first and foremost rest in a cool, dark room, and you have to sleep so that the attack goes away. Then there has to be a medical treatment, and then there have to be lifestyle changes. Now, in medicines, you can take over-the-counter medicines in which you'll have Panadols, Constans, Brufens, Ibuprofens, Neberol, Nuberol, etc. But these are mostly opioids, and they are addictive in nature. But triptans are the drug of choice for typical migraines. These triptans, they are the non-opioids and they are non-sedatives. They act on the serotonin receptors. They bind on some of these selectively, the 5-HT1, B type and the D type. They bind on them, and as a result, they cause vasoconstriction of the arteries, of the cranial arteries, because these are constantly dilated when the actual migraine attack is going on. So those are the drugs of choice. Those are available in the form of tablets, in the form of powders, in the form of nasal sprays or subcutaneous injections. Elatriptan is the drug of choice. But your doctor is going to advise you, you just don't have to take it on your own. Then other than that, if you are suffering from high blood pressure, you have to take those medicines. If you're under stress and you are needing treatment for depression, anxiety, you have to take those. You have to take your anti-seizure medicines according to the diagnosis that what is the trigger for your migraine. Then the BP has to be kept under control. The weight of the person needs to be kept under control. Especially to avoid the hormonal migraines, the ones that occur in the ladies. Because when there's too much of fat in the body, these absorb all these extra hormones and the effects are more enhanced. So you have to take care of all these things. And other than that, the other lifestyle changes that you can bring on are: don't skip your meals, avoid the stressful situations by doing yoga or meditation. Then take your regular cups of tea or coffee, which is maximum 2 to 3 per day, and have proper sleeping timings. If adjustment is needed, for example, when you are fasting or you are starting on a diet, it will take 1 or 2 days or 1 week for your body to adjust to that. In the meanwhile, try to eat healthy and try to stay cool. Exercising is a must. But if you are prone to have migraine attacks, make sure you don't exercise on an empty stomach. You have eaten something and then taken at least 3 hours rest before you are exercising, and then don't do too much of strenuous activity. So please stay healthy, get yourselves diagnosed and share the information. Thank you, and we'll meet inshallah with another topic. Assalamu alaikum.